Ladies and gentlemen, this is a story that came out on ABC News August 10th, 2020. 26 states will soon face shortage of ICU doctors. Wow. They built field hospitals, transformed operating rooms into ICUs, and crafted their own ventilators and masks. And now they're strapped for the people who make up critical care in the workforce. Researchers at George Washington University found that the majority of states are now at risk for shortages, and healthcare workers needed to treat critically ill patients, including those with COVID 19. This week's report shows alarming projected shortages over the last week in doctors, nurses, respiratory therapists, and pharmacists. Wow. The most recent update finds that 26 states will soon face shortages in ICU doctors, up from only 5 last week. 10 states are at risk of running low on critical care nurses. 7 face shortages in doctors trained to work in hospitals. 9 states will not have enough respiratory therapists, up from 0 last week. 6 states will face shortages in pharmacists. This stark prediction brings back recent memories of workforce shortages in New York City, when healthcare workers from all over the country answered the call to action. These highly trained doctors, nurses, respiratory therapists, and pharmacists all work together to provide potentially life saving care to COVID 19 and other seriously ill patients, said Patricia Pittman. And all right, so they're saying at the time when COVID 19 continues to surge in the United States, she added, our current analysis shows that most states are at risk of running low of these critical healthcare workers. Pittman's team created a tool called the State Hospital Workforce Deficit Estimator to help states and federal government gauge the demand for healthcare professionals given different scenarios of COVID 19 and the normal arbitration rates for workers. So, wow. So, this is how they realized they were short. So, workforce estimator allow policymakers to plan for looming spikes in COVID 19 cases and begin staffing up to help meet the demand. Despite an increased ability to track trends in workforce shortages, the problem is now more challenging one to address given how it takes medical and pharmacy students to be trained to work in the ICU. ICU doctors have nearly 6 years of training after medical school to become board certified, and ICU pharmacists complete 2 years of residency after 4 years of pharmacy school. The problem of a shortage of healthcare workers in ICU is not new, but it is certainly a more pressing one in the context of a pandemic. In 2019, the Society of Critical Care Medicine released a statement on the projected workforce shortage and possible solutions. Telemedicine services may pose another problem. Wow. This is what my uncle does down in Florida. He doesn't go physically in person to his doctor, they just do it over the cell phone. Advanced practice providers, such as nurse practitioners and physician assistants, may be more easily pulled up the ranks to round out the multidisciplinary team. Intensive care is primary example of a team sport in medicine. If a hospital are not fielding adequate teams, even with state of the art equipment, they cannot expect to help their patients win the battle against coronavirus. So, ladies and gentlemen, you know what? To be honest with you, I'm wouldn't be surprised if a lot of these nurses and these professionals are burnt out, because depending on where you live, if it's really bad, they have to work nonstop. I did a video about a month ago where nurses were saying they can't even take their break. They are so overwhelmed with trying to care for all of these coronavirus patients, they can't even take a break. They work through their breaks. So, y'all, please tell me what you think about a shortage of all of these specialized, trained medical professionals that are now becoming more scarce in the country, especially in 26 states. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.